Good morning, everyone. We are now going to tackle the fourth quarter module for MAPE 10, which is all about planning for a health career. In this module, our content standards will be, you will be able to demonstrate understanding of the concepts in planning a health career. And for the performance standards, you will be prepared or you are going to prepare an appropriate plan of action in pursuing a health career. So what is a career? We will be talking about career, but let us first define what is a career. A career is an occupation or profession that requires special training. Health careers are designed to familiarize students with the various careers in the medical profession and allied health services. Students will learn skills necessary for their career path. So health career planning refers to an individual's plan to make a career choice, growing in the chosen career, or making a career shift. Career planning involves the very important step of self-assessment. Self-assessment is necessary to understand one's capabilities and drawbacks. The various career options should be explored in detail to find a fit between one's abilities and the opportunities provided by a career option. It involves continuous learning and improvement to build and grow in the chosen career path. You will make a difference in people's lives when you will ask yourself, why pursue a career or why pursue a health career? So we have different reasons. People would give 6 reasons. First, it has a good salary. It also has or it is a job security or it gives a job security. You will be able to do work that interests you. You find a health career that fits your education plans and a clear path to advancement. And sometimes you work with people, sometimes not. So what are the components and steps in making a health career plan? So we have here 4 steps. First, self-assessment. Discover your personal strength through self-assessments that would include your values, interests, personality, testing skills, and etc. Second one is career exploration. You can explore different careers and work environments through career fairs, online research, meetings, internships, alumni connections, and professional resources. Third is decision making. Before you decide on taking a career that works for you, you can evaluate and narrow down your options through listing the pros and cons, comparing your personal strengths and interests, and deciding which career fulfills both current and future goals. And the last one is plan of action. Plan achievable goals and develop strategies to reach your goals. Organize your goals into smaller steps. Identify actions for each step. Utilize helpful people and resources. Review and adapt your plan regularly. So what are the different health professions we presently have in the Philippines? First, we have the audiologist. Audiologist identifies and rehabilitates hearing impairments, and related disorders. Second one is the chiropractor. Diagnoses and treats neuromuscular disorders with emphasis on treatment through manual adjustment and or manipulation of the spine. Third one is the clinical psychologist. They are the one who assesses, diagnoses, and treats and helps prevent mental disorders. Next is dietitian or nutritionist. They promote good health through proper diet and treatment of diseases. Next, emergency medical technician. They are also known as the ambulance technician, who responds quickly to any emergency and life-threatening situation to immediately treat serious injuries, physical or mental trauma to increase a patient's chance of survival. Guidance counselor. They assist students with personal, family, education, and career decisions and concerns. Also helps them develop job finding skills and other life skills needed to prevent and deal with problems. Health educator. They specializes in health education and promotes the development of health knowledge, life skills, and positive attitudes toward the health and well-being of students. Massage therapists. They perform the scientific manipulation of the soft tissues of the body for the purpose of normalizing those tissues. Uses manual techniques that includes applying fixed or movable pressure on affected parts of the body. Medical assistant. They perform under the direction of a physician various routine administrative and non-technical clinical tasks in hospitals, clinics, and other similar facilities. Medical technologist. Performs a variety of tasks on body fluids from simple blood tests to more complex tests to uncover abnormalities in the body and underlying causes of illnesses such as HIV or AIDS, diabetes, and cancer, which are not easily detected through physical examination. Midwife. Professionals with the expertise and skills in helping women maintain healthy pregnancies, assist in or perform childbirth delivery, and help in women's recovery process through the postpartum period. Nurse. They are trained to provide care for people who are sick or injured, monitors patients' health and records symptoms, assists physicians during examinations and treatment, and administers medication. Occupational therapists. They use purposeful activity and interventions to maximize the independence and health of any client who is unlimited by physical injury or illness, cognitive impairment, psychosocial dysfunction, mental illness, or learning disability. Orthotist or the prosthetist. They make and fit prosthetics or artificial parts for the human body. Paramedics. They give emergency medical treatment or assists medical professionals in emergency situations. Pharmacists. They prepare and dispense medications prescribed by licensed health professionals, also provides information to patients regarding drugs, and consults with healthcare professionals on advances in drugs or medicines. Radiologic technologist or the radiographer. Healthcare professionals who perform imaging procedures such as X-ray examinations, magnetic resonance imaging or MRI scans, and computed tomography or the CT scans that are being conducted or done in a hospital or even on an outpatient basis. Physical therapist. Examines, evaluates, and treats physical impairments through use of special exercise, application of heat or cold, and other physical modalities. Speech-language pathologist. They diagnose and treat patients with functional and organic speech defects and disorders. We also have the phlebotomist. Phlebotomist professionals are the ones with special training in phlebotomy or drawing blood from patients. Another one, we have radiation therapists. They are the ones who administer radiation therapy services to patients and observes patients during treatment. Other duties may include tumor localization, patient follow-up, patient education, and record keeping. Respiratory therapists. They specialize in the promotion of optimum cardiopulmonary function and health. Regularly deals with various chronic respiratory diseases such as asthma and emphysema. And the last one is the social worker. They are the ones who investigates, treats, and gives aid to people with social problems and helps people with mental illness, serious health conditions, financial difficulties, substance abuse problems, domestic or child abuse, unwanted pregnancy, and even other social problems. So this time, let us reflect. You get 1/2 crosswise sheet of paper and complete this chart. How do you see yourself after you have known the different healthcare professions using this table? How do you see yourself today? How do you see yourself after senior high school? And how do you see yourself after college? So you have 15 minutes to complete this test. Good luck and good day.